Good morning. I am Vishal from MBJ Medical College. Today I am going to be presenting on tomographical study of optic strut location and significance. Introduction. The optic strut connects the body of the sphenoid to inferior medial aspect of the base of the anterior clinoid process. This is the anterior margin of the optic canal. This is the optic strut. Significance. It is removed during anterior clinoidectomy and optic canal decompression. It is important for safe surgical access to tumors and or aneurysms in the cavernous sinus region and categorization of intradural and extradural aneurysms. Aim of the study to determine the attachment of the optic strut relative to the anterior clinoid process where the attachment is limited to anterior one-third, middle one-third, posterior one-third of anterior clinoid process to categorize the optic strut in relation to the prechiasmatic sulcus. Material and methods. Our retrospective study was carried out in the Department of Radiology of MBG MC in Orange. 100 head normal CT scans of the age group of 18 to 60 were studied following approval by Institutional Ethical Committee. Exclusion criteria. Abnormal CT scans showing beam hardening artifacts, calcification involving internal carotid artery were excluded. Optic strut is classified into pre-sulcal, sulcal, and post-sulcal variations. The pre-sulcal variation, the optic strut is present anterior to the prechiasmatic sulcus. In sulcal variety, the optic strut is present at the level of prechiasmatic sulcus. In post-sulcal variety, the optic strut is present posterior to the prechiasmatic sulcus. Optic strut has been categorized as anterior, middle, and posterior with respect to attachment to the anterior clinoid process. Statistical analysis data obtained were analyzed using SPSS version 20 software. Result Table 1. It was observed on the right side the attachment of the optic strut to the anticlinoid process is most commonly in the middle one-third. A similar pattern was observed on the left side as well. Table 3. Bilaterally sulcal optic strut was the commonest variant observed. 3% of cases showed presence of unilateral pre-sulcal variation on the left side, whereas right side post-sulcal variant and sulcal variant was observed in 1 and 2 cases respectively. Table 4. There were significant gender differences in the type of optic strut observed in males and females. Asymmetric optic strut was observed in 3% of cases, of which 2 were males and 1 was female. Symmetric optic strut was observed in 97%, with sulcal variety as the commonest in both males and females, accounting for 50%. Discussion. Carreta's study on the American population showed the highest variation of sulcal variety of 44%. Kalinopoulos' study on the Greek population showed the highest variety of post-sulcal variety of 41%. Our study on the South Indian population showed the highest variety of sulcal variety of 50%. Conclusion. There are not many reliable anatomical markers to discriminate the intradural and extradural aneurysm in the paracellular region. Ophthalmic artery, anterior clinoid process, and optic strut have been considered the previous literature as landmarks for discriminating aneurysms. Of all the above anatomical landmarks, optic strut is the most reliable owing to its small size, enabling the radiologist to accurately identify the location of the dural ring, helping in planning treatment of modalities. These are my references. Acknowledgement. I would like to thank Dr. Afroz and Dr. Sangeet, the Department of Anatomy, faculties, PGs of Department of Radiology, MBG, MC Naresh for the valuable support throughout my presentation. I thank HGTE and ATCON for giving me the opportunity to present my paper. Thank you.